I'm Adrienne Trigg. I represent myself, and I also represent the group Protect Texas Fragile Kids regarding Charge 4A about Medicaid quality. I have a handout here too as well. I don't know if who this goes to. I am not paid to be here today. I'm a parent. I am not a corporate administrator. I am not working for any of the state departments that have testified today, but I do consider myself a stakeholder. I have been a UT guest lecturer for access to health care for medically complex children that use Medicaid. And I'm wondering why, I have a question to you today, is why none of the users or considered stakeholders have not been invited to testify today. And there are obvious issues with the MCO model. Those issues have been stated here multiple times by me and by many other people. And those issues and the changes in the Medicaid have been evidenced by the 141-0 vote in the unanimous support in the House during the special session with HB 25 to restore funding cuts. And I want to know why the Senate is silent in this issue. And to me, that speaks about apathy, and that's really been loud and clear. For months, we've been dragging our medically fragile children to the Capitol at their expense that takes them to get here with their wheelchairs, their feeding tubes, infusion lines, catheters, home health nurses. We take them out of school. And the cost to us is great to come to testify. And today, there's not a lot of us here because the risks really just haven't outweighed the rewards to be here. We've heard a lot about cost savings. What I handed out to you is from the MCOs, and it's their objectives. And what I've heard from all the testimony here today has been about cost containment and cost efficiency. If there are 6 objectives, then only one is being looked at. I mean, really, if you're looking at this, reducing administrative complexity of delivering Medicaid benefits, that is a huge oversight right now, especially with families with medically complex children. We've heard a lot about diabetes, asthma, and high cholesterol, and those may have had good successes, but when you are looking at medically complex children, like my son, who's had 22 surgeries and has over 26 diagnoses, and I'm looking at, and I've heard a lot about better coordination of care of recipients under the program and better health outcomes, and how the MCOs and how the insurance companies are to get the benefit from that. I take real offense and insult. When I look at the healthcare outcomes, not one of them have ever been in the hospital with us during these 22 surgeries or helped in the recovery at home. So those health outcomes, the improvement of them, are because our kids are at home and they're getting the quality of care that they need. But the administrative complexity in this delivery model is just subpar. Thank you.
Thank you for your testimony.